Dr. Eisenhauer, it's been a while since we've sat down and we've added the camera today for radio rounds. I want to talk a little bit about day surgery and kind of what your participation is in that at Pardee Hospital.
Be happy to help you, George.
All right. For example, you were just over there today doing some day surgery over there. What is the procedure like? Is it a long process? Is it a quick process? Does it depend on the surgery?
It depends on the procedure itself. Generally, there are certain parts of it that are very comparable regardless of the procedure, whether it's an orthopedic procedure, a general surgery procedure, ENT, or even a gynecologic procedure. All the patients have to come over and they have to register and check in, and they'll go to the preoperative area where they'll be prepared for the surgery. Then they'll come to the operating room, and that's the part where we obviously actually do the surgery. And then there's some recovery after that, and the recovery itself depends on the procedure and what type of anesthetic they've had.
Now, being in the day surgery, and there are so many different procedures that can happen there, do you have to have a skill set that provides many different opportunities for different types of surgery, or do you pretty much stay within your field that you're trained in?
As far as the surgeon, I just do procedures that I'm trained to do. All of those that a general surgeon would normally do, as well as thoracic and vascular procedures. That doesn't vary. Each physician does what they're trained to do, what they are comfortable doing, their area of expertise. The nurses that are there in the day surgery area, they prepare all of the patients, so they have some cross-training because certain types of patients are prepared a little bit differently depending on the procedure that they're having.
For a layman, what would be a thoracic procedure?
We operate on lung cancers. Sometimes if you have blisters or blebs on the lung and they cause you breathing problems or a collapsed lung, we operate on those. But the vast majority of these are because of tumors or growths or infectious processes.
Now, one thing we talked about with Dr. Timmerman is the idea that patients come a little bit early to day surgery because there's a lot of procedural stuff that needs to be done, a lot of double checking and triple checking to make sure that they're ready for this. When you as a surgeon walk in there, what do you need to know to be comfortable with going ahead with the surgery?
Well, we always see the patients in the preoperative holding area. That way they know that we're there, they see our face, we're familiar. We review the paperwork. We ask the patients typically, or I ask the patients typically, if they have any last minute questions. Has anything changed since I had seen them in the office? Because sometimes it's just 2 or 3 days when I saw them here in the office until the time of the procedure, and other times it may be 3 or 4 weeks. And so we always ask them if there's been any changes in their condition, any new symptoms or any new problems that have arisen. And then we go over the paperwork that is there so that we verify all of that information so that we feel like we're adequately prepared to take the patient appropriately to the operating suite.
What do you think are the greatest benefits of day surgery through Pardee Hospital? What do you like that's over there that's happening right now?
Outpatient surgery in general is something that has progressed significantly, even in my career, to where we used to have patients come into the hospital, particularly, for example, gallbladder surgery. They would be in the hospital for 4, 5, 6 days, have pain and debilitation for about 4 weeks or 5 weeks, and we now do that as a straight outpatient, and they're sore for 3 or 4 days, back doing most of their normal activities in 5 to 6, 7 days or so. And so the outpatient surgical department has had to evolve into caring for these patients a little bit preoperatively, but also postoperatively, because before, patients would go and register, and then they would have their surgery, and then they would go on to into the hospital for the rest of their rehabilitation or their recovery, whether it's for 1 day or 3 or 4 days. Now a lot of these patients are going back to the outpatient surgery department, and so the nurses have had to culminate their skills into ones that are true recovery room type nurses, providing care for those patients, understanding when it is safe to let a patient go home from the day surgery department, and understanding when there potentially is an issue that arises that they need to contact the surgeon and say, hey, we have a problem here that I think we need to have evaluated before this patient goes home. And in those situations, we'll see the patient and say, yeah, this is okay, we'll follow them up, or hey, this isn't okay, we're going to go ahead and admit the patient overnight and monitor them in the hospital where we can keep a close eye on them.
Now, what has changed about medicine that is allowing us to do that?
Technology is a large part of it. We used to do gallbladder surgery through a 6 or 8 inch incision. I now do it with one less than 1 inch incision at the belly button. So when you do that operation with that minimally invasive approach, there's less pain after the surgery, less trauma to the abdomen or to the patient themselves, and so it can be done with less discomfort. Pain that is controlled with pain medicine that we can give the patient at home. There's less nausea, there's less rehabilitation from the GI tract itself, recovering from the surgery, using these less invasive techniques. And then just the safety issue, things that we used to admit patients to the hospital for, we realize that, hey, they can be safely managed at home, and oftentimes better managed at home because they're in their own environment, their own refrigerator, their own recliner, their own bed, they're more comfortable. And in that situation where we know it's safe for them to rehabilitate at home, oftentimes they're more comfortable in that venue.
What does the future of day surgery look like? Things that are coming up in technology or changes that might be making it even easier and quicker?
I think the two areas that we would look at expanding, one, what additional procedures can we do as an outpatient that we're currently admitting patients to the hospital for? And there are some changes, again, with evolving technology that we can do that. The second thing is trying to differentiate those patients that go home and come back because they're having problems or issues, and those that sometimes stay that don't really need to stay. So I think as we try to focus our skills on what can we, what issues or what problems do we see that indicate a patient should stay in the hospital versus what are the circumstances that we can let a patient go home and recover at home.
Dr. Eisenhauer, thank you so much.
Thanks, George. Always a pleasure to speak with you.
Appreciate it.
Bye.